providing client privacy. Hi, my name is Ty and I'll be your student nurse today. May I get your name and your full name and birthday? Okay, Mrs. Smith. Today we are going to do a dressing assessment and change. Do you have any allergies to any medications? No? Are you in any pain right now? We did do a give you some pain medications 30 minutes ago. Are you feeling a little pain on a scale of 1 to 10? What's the pain? It's 2. Okay, not too bad. Looks like the pain medication is relatively doing its job. So I assess for the client's pain, allergies. I am checking to provider's note to see if their provider's note, and then I'm sanitizing. I am going to raise the bed to a comfortable position for me. And Mrs. Smith, are you comfortable with this position? And Mrs. Smith is comfortable. And now I'm going to sanitize. I just did, and I'm going to don some gloves. I'm going to put this bath pad underneath her for the drainage. And I'm also going to uncover Mrs. Smith. We're going to uncover her just as what we need to uncover for privacy and client dignity. Not to uncover too much. And then Mrs. Smith, can you turn to your side? We're going to put this pad underneath for protection. And then we did that. And then going to sanitize again, put on new gloves, and we are going to remove. And earlier I provided client education because I told her I was going to change the wound and assess it. All right, so keeping the skin tight, I'm going to pull away slowly. If it was stuck, I would use a solution to rub around it and to loosen it up. And we're gonna pull away nice and slow, and then we are assessing the dressing for color, for smell, for drainage, type of drainage. Mrs. Smith, are you in pain? We're checking her tolerance as we go on to see if she's in pain. She's fine, reports 2. And then we're going to document the amount of drainage also and the type purulent. And then we're going to throw it in the biohazard container. And then we are going to measure her wound. And making sure, we're also checking the outside, the layers of the outside boundaries of the wound for skin integrity, for lesions and infections and pus and all that stuff. It looks healthy and fine. If there was any extra drainage, we would clean that up too and document that with the rest of the drainage. And then we would measure, making sure not to touch the side of the wound that could hurt. So, oops, and I didn't mean to throw away my ruler there. And it is 3 centimeters, okay? Again, and then by 11 centimeters by 2.5 centimeters. And we're gonna throw that away and we're gonna document that. Now I'm going to set my sterile field. I'm gonna change gloves, sterilize. I'm going to come over here and I'm going to don new gloves. Mrs. Smith, are you still comfortable in any pain? Okay, you're doing well. We're we're halfway through, and now we are going to open our packet, and we're going to set our sterile field. Okay. All right, I'm going to set my sterile field. The whole time I'm making sure that I am not turning my back towards the patient for sterile field integrity. I am not putting my arms or hands underneath the sterile field. Okay, and now I'm going to dump my contents without touching anything. Okay, I'm going to set this down. I am going to dump my solution out. And there will be certain items that will go in the trash, and certain items that will go in the biohazard bag, dependent if it's contaminatized with biohazard. And then I am going to just set everything ready. Set my garbage bag. All right, now I'm going to put on my sterile gloves, so I'm going to change. I'm going to sanitize. Again, Mrs. Smith, are you in a comfortable position? And no pain? Okay. Assessing for comfort. And then I'm going to put on my sterile gloves. All right. For reasons, the gloves are too small for me, so I actually had the extra large glove put in here. Sanitize again. Put it on the wrong way. Sorry, do over. Put it on. Oops, my hands were too wet. Okay, so I'm not going to touch the gloves. I'm gonna just touch at the edge here. There we are. Again, on this side, this time I'll put it on correctly, hopefully. So now I'm going to throw this away. So now I'm going to pack the wound. Okay. Squeeze out the excess solution. There. Right. Making sure not to touch the edges of the wound. You're not in any pain, Mrs. Smith? No? Okay, you're doing very well. And we're going to pack it nice and neatly and firmly onto the skin. Great. And now we are going to put the gauze on. Making sure it's 1 inch away from the wound so it can be covered well. And now I'm gonna tape the wound. But before I tape the wound, I'm gonna sanitize again. Alright, I am going to once again sanitize. I am going to date, time, and document the date, time, and where the wound is. Okay. Now I'm going to put the... Mrs. Smith, are you in a comfortable position? Oh, no. Before I do that, sorry, before I do this, I am going to put my So I sanitize. I'm going to put my pad on with the blue facing up. And then I'm going to tape. Sorry, so the tape was wrong. And then I'm going to tape. I'm out of tape, but I'm going to tape. And then I'm going to document the date, the time, and where the wound was. Sanitize. I'm going to cover up my client. Mrs. Smith, are you in a comfortable position? Yes, you are. I'm going to lower the bed, lock the bed, call light. Are you in any pain? No? Okay, and now I'm going to call light, pain, position. If relevant, your purse is here. I'm going to, again, clean up. All right. And certain things will go into the trash, and certain things will go into biohazard. All right. I am going to sanitize again, and then I'm going to document the type of dressing, tolerance to the changing, type of wound, type of drainage, color of the wound, any odor, and any and anything unusual. And then I document it, I sanitize, and I'm going to leave the room and provide privacy.